We presented at the ESMO conference a further analysis looking at the effect of Rucaparib in patients who've had either a complete or partial response to chemotherapy. Many patients undergoing chemotherapy for recurrent ovarian cancer only have a partial response. They're left with disease at the end of chemotherapy, and they then start the maintenance therapy. Now, what the maintenance therapy does is to prevent disease recurrence, but it is also active treatment that will reduce further the tumor burden. And what we saw in the Aerial 3 Rucaparib trial was that the benefit of Rucaparib was seen not only in patients who had a complete response to chemotherapy, but also those who had a partial response. And the magnitude of the effect of Rucaparib was similar in both groups. We also saw that a proportion of patients who had measurable disease at the time they ended chemotherapy had a further response to Rucaparib. In the BRCA mutated population, that was a 37% response rate. So the drug is not only a drug of maintenance, but it's also a drug of therapeutic value in patients with ovarian cancer.